Thank you so much for your attention. Good afternoon. As he said, I am Dr. Layla Jaffree. I am an OBGYN at OceanMed, and the topic of my presentation is emerging therapies in gynecology and women's health. Let's see if I can get this right. There we go. So he went through, like I said, the first half of my presentation. So I will say that I do have interest in cosmetic gynecology, minimally invasive surgery. I do robotic surgery here on the island. And I am also particularly interested in menopause treatment. And I think the presenters before me were so very well placed, because I wanted to stand up and give a round of applause when he talked about how important our hormones are and what role they play in a woman's lifespan. So I have no disclosures. I wish I did, but I do not. I don't own any stock in any companies. So just to give a little bit of background, we are an aging population. So the lifespan has almost doubled in the past century. Women are living longer. According to a CDC report in 2022, the average woman in the U.S. was, the lifespan was 80.2 years, and in other parts of the world, it's much longer. That being said, women spend about 33% of their lifespan in some form of menopause, whether it be perimenopause or complete menopause. Women comprise about 52% of the population in the U.S., and globally about 49% of the population. And women consume about 59% of all prescription drugs. So absolutely. So women's health is definitely important socially as well as economically, and we should all take note of that. Given that we are living longer, we now are focusing more on health and wellness, and we are realizing that quality of life is important in our later years. And so what affects quality of life? It is functionality and vitality of our organs and our tissues. And in gynecology, that is even more important when it comes to pathology that affects women. And so that leads me into my topic. So what are the problems? The problems are vaginal symptoms. They include urinary symptoms, aging and insensitive skin, recurrent urinary tract infections, and these problems all fall under this umbrella term of genital urinary syndrome of menopause. About 40 to 54% of women in menopause have these issues, and about 15% of women who are premenopausal also have these issues. But we know that women oftentimes do not talk about these issues. They don't bring them up to their providers. They're often embarrassed or ashamed to talk about them. And so these numbers could be incorrect. There's probably a lot more women suffering in silence. And oftentimes women do not feel like there are any treatments or any ways to treat these symptoms. They think that everybody must go through these and there's nothing to do about it, so why would I even speak up? So in terms of vaginal symptoms, women can experience vaginal dryness and irritation and burning. These can be constant symptoms that they have to endure all day long when they go to work. Just imagine if you're feeling uncomfortable down there and there's nothing that's done about it, how that impacts your functional capacity in your jobs. There's also thinning skin, vaginal and pelvic pain. Women also experience vaginal bulges as the tissues become weaker and lose that elasticity. They also have sagging and drooping of tissues as well. Urinary symptoms include painful urination, overactive bladder. This means women experience a lot of urgency. The minute they get the urge, they have to get to the bathroom. I've had patients tell me as soon as they go anywhere, they're scoping out in the room where the bathroom is because they know as soon as they get that urge, they have to get there. Urinary frequency. I've had patients tell me they go to the bathroom every hour on the hour. I mean, just imagine. Nocturia, waking up multiple times at night to urinate. Of course, that's going to affect your sleep and your productivity and your quality of life during the day. Leaky bladder, stress and urge incontinence. So you laugh, you pee. You sneeze, you pee. Very, very debilitating and embarrassing for women. Oftentimes, again, we don't talk about these things. We just deal, right? recurrent urinary tract infections, which can be very debilitating later on in life, right? If you have, especially for certain populations of women, if these go untreated, they can be life-threatening. People develop urosepsis, urethral caruncles, other types of infections of the urinary tract. Sexual symptoms, of course, with the other symptoms we talked about, of course, why wouldn't sex be painful and uncomfortable? Decreased lubrication, bleeding after intercourse, which can be very disturbing, not only for the woman, but for her partner, who wants to feel like I caused this type of scene, right? Sometimes I've heard it described as a murder scene. Decreased arousal, loss of libido, slow or inability to orgasm. These are things that are important, especially in terms of interpersonal relationships. And so how can we fix it? Well, fortunately, we do have traditional therapies that are widely available: vaginal lubricants, vaginal estrogen, hormone replacement therapies. For urinary symptoms, we have pharmacotherapy, as well as surgeries, including sling, suspension surgeries, and implants. And while these are excellent options for a lot of women, they do have, they're not necessarily options for everyone, right? So not all women can have hormones, right? Some people have pathology, or people have risk factors that would preclude their use of hormones. Some women experience side effects with some of the pharmacotherapy that we have available. And then some women feel like their symptoms aren't severe enough to warrant surgery, right? They don't feel like the symptoms would warrant the risks that surgery involves. And so what do we do for those patients? And so fortunately, there are emergent therapies. So these therapies are separated into energy-based therapies and biologics. So energy-based therapies include radiofrequency therapy, lasers and diodes, predictive permeation, high-intensity focused ultrasound. The biologic therapies include PRP, or platelet-rich plasma, as well as platelet-poor plasma, amniotic fluid, exosomes, growth factors, carboxytherapy. All of these, some of these are in different stages of investigation. Not all of these therapies are FDA approved, but the two top therapies that are circled in red are the ones that I use in my practice and that I'm going to talk to you about today. So in terms of radiofrequency therapy, this therapy has been around for over 100 years. In the 1920s, it was used for electrocoagulation, and then over the years, its use has expanded. In 2002, it was first used for non-ablative low-frequency therapy. It is used in surgical procedures. As you can see here, we use it in nerve ablation surgeries. We use it in, they use it to ablate different lesions. As you can see, this liver has a mass of some sort that's being ablated. We also even use it in gynecologic surgery with the treatment of fibroids. We can ablate fibroids with radiofrequency therapy. I actually had the opportunity to do that back in Atlanta, where I'm from. So that is at higher frequencies. But it has been FDA approved at lower frequencies to treat dermatologic conditions of the skin, and that includes loose skin, thin skin, dry vulva and vagina, as well as insensitive skin. And in the EU, it's been approved for vulvovaginal laxity. And as you can see, the top picture kind of demonstrates how I use it in my practice. So I can use it inside the vagina. I can tighten the tissues of the vagina. I can tighten the tissues underneath the bladder, right? I can tighten the tissues underneath the urethra. And I can even treat externally, okay? So how does it work? Well, it works through thermal effects. Immediately, it causes contraction of the collagen fibrils in the tissue, improving tissue tightness. It also stimulates the nerves in the tissues. Those nerves release neuropeptides that communicate with the blood vessels in the tissue to stimulate and increase blood flow to the tissues. It also increases the moisture. Once you have more blood flow, then we can have a transudate that causes moisturization of the tissues. It increases sensitivity in the tissues and reduces inflammation. And it does all this without causing any damage to the tissue. It is non-ablative. So as you can see here, these are some histopathologic slides. This is from a study that was done in 2016 looking at women with GSM, or genital urinary syndrome of menopause, before and after treatment with radiofrequency therapy. The picture on the, what are you guys looking at? The picture on the right side is pre-treatment, so you can see that purple layer at the top is the epithelial layer of the vaginal tissue. And so that is before treatment. And then the picture on the right, that's your right? That's right. The thicker epithelial layer. You can see that the epithelial layer has significantly thickened. There's several more layers of cells. And then the rate pegs, which are the little indentations in the epithelial layers, have become thicker. And that's a sign of healthy tissue. Again, here on my left side and your right side, the epithelial layer is much thinner. That's pre-treatment, and then post-treatment on the other side. I'm not even going to try to confuse myself. The epithelial layer has thickened, and the rate pegs are much deeper. Here is a stain pre- and post-treatment for collagen. And so, again, before treatment, the collagen is stains a lot lighter, and then after treatment, the collagen is a lot darker, indicating a denser amount of collagen, more collagen, and elastin as well. And then here in the substromal tissues, you can see before treatment with radiofrequency therapy, the tissue is a lot thinner. There are a lot more air pockets in the tissue, and then after treatment, they were able to show thicker stromal tissues, all indicating thicker vaginal tissues. And then in a landmark study in 2018, they were able to show, for the first time ever, increase in density of small nerve fibers in tissues. And we believe this is how radiofrequency therapy has its effects on increasing sensitivity, as well as treating overactive bladder syndrome symptoms. We think that it's something to do with the wiring, and the radiofrequency helps improve that. So the risks. So there are no severe side effects. There was a study done looking at the MOD safety reports, and overall it showed that the risks are very mild. Some reported increases in sensitivity that were short-lived. Some complaints that were seen were related to disease progression. Isolated cases had to do with device malfunction, which there are a couple different devices that do transcutaneous radiofrequency therapy. But overall, there were no severe side effects. And the benefits, well, you get non-surgical tissue tightening and improved function of those tissues. It's very comfortable. There is no pain, so no anesthesia is necessary. Literally, women come from work during their lunch break, have the treatment, and go right back to work without any downtime. They can also engage in sexual activity that night if they desire to. So it's safe and effective, and I am excited to offer it in my practice. Moving forward, because I am probably at 8 minutes now, I'm going to try to hurry up. The other therapy that includes the biologic therapy is PRP, or platelet-rich plasma. As you can see here is a picture from an electron microscope with an aggregate clump of platelets that are there, probably helping to repair some damaged tissue. And so to understand how PRP works, we have to understand, why do we fail to heal? Well, we fail to heal because over time, our stem cell number and activity decrease. So when we're born, when we're little babies, we have tens of millions of stem cells, and those significantly decrease as we age, again, related to hormonal changes. The decreased stem cell number and decreased activity lead to decreased tissue repair and altered tissue function. There are other changes that can affect our ability to heal, including poor nutritional status and chronic inflammatory states, but by and large, it's because we have a reduction in the number of stem cells. PRP is concentrated platelets. They are rich in bioactive proteins and growth factors. They stimulate cellular regeneration and accelerate tissue repair. This has been around for greater than 30 years. It's been used in multiple other fields, including orthopedics. It's used in aesthetic medicine as well, and it's coming to GYN via me today. So it is autologous, meaning we take it from the patient's blood. We use their own blood, and we produce this. It works indirectly and directly. The platelets, when we inject them into the tissues that we are treating, they have direct effects on the tissue, and then they also indirectly call all of the rest of the immune system to come to that tissue and to repair and heal it. It contains growth factors, white blood cells, red blood cells, proteins. Platelets have thousands of growth factors, over 2,000 different growth factors that all are designed to come and repair tissue. So these are just a few of the ones that I felt stood out. Platelet-derived growth factors repairs blood vessels and increases collagen production. VEGF, it improves it improves blood flow as well, treats the vascular endothelial cells. Fibroblast growth factor, fibroblasts are very important in collagen and elastin production, so this stimulates the fibroblasts. Epithelial growth factor, promotion of epithelial cell growth, wound healing, TGF-beta, again, endothelial cells, promotion of wound healing. So platelets are rich in these proteins that then call the rest of the immune system to come to the tissue that it's directed to heal and repair that tissue. So the benefits, it causes tissue regeneration, wound healing, scar revision. It has skin rejuvenating effects. So on the left side, you'll see whole blood. This is it circulating in the vessels of your body. It contains white blood cells, red blood cells, platelets. As you can see all the way to the far right side, this is what happens when we spin that blood down. It separates into its components. The central portion, called the buffy coat, is the part that contains the platelets as well as white blood cells, and that part is diluted slightly to make what you see in the center, which is what we call liquid gold, the PRP, and that's what we inject into tissues. And so, because I don't want to offend anybody today, I didn't put pictures of what can happen in the vaginal tissues, but we will see what happens on the skin of the neck and the face. As you can see here on the, what are you doing? The right side, we have a scar across this patient's neck. This was treated with PRP, and as you can see, the scar is almost completely gone, okay? This other patient had PRP injected into her face, the skin of her face. As you can see, the skin before is very frail, very pale. You can see through it. And then after treatment, her skin is significantly thicker and vibrant looking. So we can inject directly into the tissues of the vaginal wall, underneath the urethra, adjacent to glands and nerves. We can inject sexual organs. We can inject vulvar skin and even the bladder epithelium. So just imagine what this can do. So to recap, I have 2 take-home points. 1, menopausal conditions can significantly impact a woman's quality of life. We should definitely take note. Newer treatment modalities such as radiofrequency therapy and PRP are safe and effective options for treatment and the management of symptoms. Thank you so much for your attention.